Hello, and welcome to this webinar titled COVID-19, Using Data to Understand Secondary Impacts. This webinar is organized by Internews in the Rooted in Trust project, funded by USAID's Bureau for Humanitarian Assistance. I'm Sunny Krishnan, and I'm the Regional Health Advisor for COVID-19 for Internews. Now, the global crisis caused by the COVID-19 pandemic is unprecedented in nature. Emerging as a health crisis, the pandemic has become a threat to global prosperity and stability. The emerging secondary threats of COVID-19 include food insecurity, the loss of livelihoods, the severe strain on crumbling health systems, and the deepening inequalities for women and girls. Datasets to provide information on the secondary impacts of COVID-19 have been developed by organizations like ACAPS. Now, it is crucial that journalists understand and use this data in their stories and offer a check and balance to the work of governments, businesses, and institutions responding to the COVID-19 pandemic. Now, without much ado, let me now introduce you to our first panel speaker, Claudia Manili from ACAPS. Claudia is a mixed methods analyst with ACAPS. Her track record includes working for INGOs and UN agencies in several countries, such as Tanzania, Greece, Iraq, and Ethiopia. Now, ACAPS stands for Assessment Capacities Project, and it is a nonprofit project of a consortium of 3 NGOs, the Norwegian Refugee Council, Save the Children, and Mercy Corps. ACAPS also provides independent, groundbreaking humanitarian analysis to help humanitarian workers, influencers, fundraisers, and donors to make better decisions. Now, a couple of housekeeping announcements before I pass the floor over to Claudia. Firstly, please mute your mics and turn off your video when you're in the webinar room. So all you guys who are waiting to go into the webinar room, just bear with me. I'll allow you to enter soon. Please post all your questions in the comments channel of your Zoom dashboard, yeah? Okay, and just a point to note, this webinar is also live on Facebook. So if you miss it on Zoom or you can't enter Zoom for some reason or whatsoever, you can follow this webinar live on our Facebook page at Internews COVID-19. So now over to you, Claudia. Thank you so much.
Thank you, Sonny, for the nice presentation. I'm trying to share my screen. Please confirm if everything goes smoothly. Share. Should be fine.
Yeah, I see it. Very good. Thank you.
Okay. So thanks for the nice presentation. I'm Claudia Manili, Mixed Methods Analyst at ACAPS, as Sonny mentioned before. I was planning to explain a little bit what ACAPS does, and Sonny did it amazingly already. But I will say a couple of things more. ACAPS is a project, non-profit project based in Geneva, and we provide humanitarian analysis on several countries at global level, and based mainly on secondary data review. And normal business usually for us means monitoring the crisis around the world globally, and try to collect data and spot the latest humanitarian developments and provide real-time analysis for what's going on. Of course, like at the beginning of this year, we were facing the pandemic as well. And we decided the pandemic is kind of not unusual crisis that we deal with. And we decided kind of fast, what can we do as a secondary data analysis provider based in Geneva? What can we do in a situation where we were all more or less stuck in our own countries? And actually we found ourselves a little bit, let's say, in a good positions. Why? Because we do secondary data analysis, meaning that we rely on what's already existing on the internet, what's already available out there as open source, and we already had methodologies on how to go and approach data that were taken and collected by someone else, how to select them, how to let's say assess the reliability and how to use them. This was kind of a skill that was kind of actually very useful at the very beginning of the pandemic. And this allowed us to develop very quickly data collection processes. So during the very first month of the pandemic, we developed the first product, that is the government measure dataset, which I'm going to explain pretty much in detail, which has been a project that actually is the one that we are still doing. It is the longest one, is the most consolidated one. So it's the project and the product that we also feel way more comfortable in presenting around. The second product that we published, it's a humanitarian exemptions dataset that basically was trying to track whatever humanitarian exemptions was granted to humanitarian actors in their kind of operations. This has been a very interesting product with a lot of interest, but it was one-time product for us in coincidence with our big humanitarian access assessment. So I'm not going to present this data set, but of course you will find it on our website. And then I'm going to spend some words and to present our newest data set, which is the secondary impacts data set. For this one is very new, and I'm just going to present its structure and potentially what can bring to the analysis of COVID-19. I hope so far it's clear, in case there is a Q&A at the end, and don't hesitate to have questions in case. Let's go into it, starting with the government measures dataset. So, as you can see in this slide, there are a couple of screenshots. One is just the branding that we used at the very first page of the datasets that you can download, and the other one is a screenshot of actually how it looks like. We started collecting data on Friday, 13 March, which was like very beginning of all the let's say lockdown measures, and when we saw the first big spike in cases in Europe. So we acted like very rapidly. I remember those days. It was like decided in a couple of days, what can we do? We sit down with other organizations and we realized that there was the need of a product that was tracking consistently what the government decided to take, which measures they decided to take to contain the pandemic. I remember there were very hectic days, but what we did, we started working in-house with our analyst, and we, instead of saying, okay, let's try to track these coded measures, we decided to first have a look of what was around. So instead of starting with already fixed categories, we decided to have an ongoing deduction process, meaning that we were seeing what was already available and enforced by the governments, and we decided then to group the government measures in different categories. And this was done in a collaborative way with a bunch of analysts with trained, experienced within ACAPS, and we came up with an analytical framework that then we used to code our data. And to coding, I mean classifying the information under specific categories to help analysis. The data set is structured in a very simple way. Every entry has a different ID. Every entry has a country of reference. Every entry has a regional reference, a specific area, if applicable. And every entry refers to a measure or packages of measures within the same category and within the same, let's say, enaction date. I suggest it's very important always when you look at this data set to have a look at the comments, because there is always the human eye behind coding and the human work behind coding, and there are small differences within, let's say, how an analyst would conceive one measure and would differentiate one measure with another one. So I would say, as a data person, that it's kind of well structured and clear how we coded things, but of course you always need to have an eye and to be careful, because sometimes human mind, they work differently, and especially within the government measures data set and whatever our governments enacted during COVID-19, we saw that many measures were super nuanced, meaning they could be interpreted and classified in different ways. So our process also of exchange of ideas and exchange of analytical, let's say, opinions was really essential to come up with a more or less consistent way of coding data. I'm going to present to you the analytical framework we used. So after of having seen our government measures around, we decided that we identified 5 main categories, which are like governments and socioeconomic measures, meaning all the measures belonging to this field. Public health measures, which probably these are the most easy to spot, like wearing masks or vaccination campaigns or whatever, which is not happening, but in case whatever was was enacted in this matter by the government. Movement restrictions, like suspension of international flights, border closure, visa suspension, social distancing, still going on nowadays pretty much, and lockdowns. And these are just big categories. And under these 5 big categories, we have 34 measures. So every category has its own bunch of measures where that can describe the reality out there. For any further specification on how specifically we coded these measures, we have a README that you can find in the same page as you can download our dataset, and in that document you can find really the specifications of every single measure and the description of the dataset. Second dataset. Secondary impact set. This is probably more in line with the type of analysis that you guys at Internews wanted to go on with this webinar. And what I can say about this, it's a very new data set. It was first published on September 9th, 2020. But as you can see from the slide, it's still in beta version. What does it mean? As you can imagine, secondary impact is kind of, let's say, holistic. Many different topics they fall under the secondary impact topic, which made, let's say, the construction of a data set trying to track and to measure the secondary impact kind of more difficult. And the whole process of the analytical let's say, structure and the analytical framework behind this was kind of more complicated and needed way more collaborative sessions between analysts. So still in beta version, we are still collecting the data, as you can see from this dashboard on my screen. The highlighted countries are the data we have available so far. So whatever you see in this dashboard doesn't mean anything regarding secondary impact. It just means where the data is available. And always in this slide, you see the structure of the data set that looks pretty much as the government measures data set with the same rule. One ID is one country, is one measure, and it has one value. I should say that with there is one main difference between this data set and the government measures data set. The government measures data set, it's a global product. So we track the measures everywhere in the world, no matter if it's a crisis or not. We will do the same for the secondary impacts data set, but we are including in our analytical framework some indicators that are actually belonging to the humanitarian sector. Now I'm trying to go a little bit behind the secondary impacts dataset, presenting what so far we believe is the good analysis framework to measure secondary impact. So this time we have 4 pillars. The 4 pillars we classified our information are whatever it's falling under the health pillar, an impact that government measures and COVID-19 might have had in the health sector. Living conditions of people. Operational environment, which is, as you can imagine, is more the, let's say, the humanitarian focused pillar, and social cohesion and protection. Behind these 4 pillars, we have 13 thematic blocks. These blocks, they try to explore indicators belonging to the health sector, mental health, economy, education, food and nutrition, humanitarian access, humanitarian development programming, governance and humanitarian rights, and so on. And below these 13 thematic blocks, we have approximately 80 indicators, qualitative and quantitative. So as you can see, it's way more complicated than the government measures. And let's say it's still in beta versions for this, because we need to have the data collection done for more or less the majority of countries to be able to consolidate our analytical framework, meaning some indicators might stay, some other indicators might be identified, and some other indicators might be dropped. That said, what is common between these 2 data sets? The structure. Both data sets are structured as repositories of measures or repositories of indicators. What does it mean? They are not an index. So this data, it's raw data that you can use to build your own analysis. But the amount, for example, of government measures doesn't measure the severity or the stringency of these government measures. This is something that you can come up with further analysis, but you don't have this information straight out of the data set. Same as the secondary impact data set. It's structured in a way it puts together indicators to allow third-party analysis. That said, we can assure ACAPS quality, meaning that there is a strong data collection process that is followed by our analyst, and it's advised by our analyst, but actually is not done by let's say artificial intelligence or data scraping by machines. Is done exclusively by volunteers, which are students from different universities trained by ACAPS staff and constantly followed. So training in our methodologies on how to select sources, how to control the quality, and how to approach numbers around the web, it's already ensuring some type of quality. On the top of that, we following them and discussing with the volunteers allows to have more quality control on whatever gets into the data set as content. As well, our sources, especially when it concerns the government measure sources, for us it was very important to try to track mostly governmental sources, especially on these times where you do have news everywhere and you don't really know which sources are reliable or not. For secondary impact as well, we try to use institutional sources mostly, but of course we have a look also on other sources such as international newspapers, local newspapers, but always we try to triangulate whatever we put in our data sets. And that, as I mentioned, as 4 points, the quality control. Quality control, we are constantly tracking and reviewing whatever goes inside the data set. That said, there are always going to be some bias in the data and there are always going to be some bugs. But we try to ensure, let's say, to put out there a good enough data set that is controlled and it's, let's say, with enough quality. Sorry, yes. To wrap up, some data consideration. Use our data sets. They are, let's say, they have enough quality. There is a quality insurance. They are well structured, and we know the data collection process. But you should always approach every data set you use for data analysis in the same way. Like, you should always check the sources behind your data set. You should check the methodology that is used behind the data that is collected, because data collection makes a huge difference in making the quality of data, and is also making data sets comparable. Because what we saw during especially the very first weeks in the pandemic, people, journalists, organizations were using data that were not comparable. One very, very, very easy example, comparing the infection rate between countries that have a different health system and a different way to count the test done to people and to count the positivity rate, and also different ways of different policies behind the testing numbers. So when you compare numbers that refer to different methodologies, most of the times you will have results in your analysis that are misleading. So these considerations, it's like to say, check your sources, check the methodology behind your sources, make sure the data is comparable. Then, if we don't have comparable data, whatever you produce as analysis piece or as article, make sure you're transparent for whatever you say, and make sure that whatever statement you come up with, then you're transparent in saying, I might also be wrong in my interpretation. That's what at ACAPS we do as analysts. We're not journalists, we are analysts. We produce analysis. Our analysis is open source. So you need to try really to be transparent in how you look at the data and how you get conclusions out of your data. That said, these are the links of our two data sets. It's enough to go into www.acaps.org, and basically in the homepage you will find all the different links. You will find the README for further information on data sets, and there is a big news. We have an API, which is like you can touch yourself directly in extrapolating data of our different data sets. Not all yet are available, but we are on the way to making them all available. I just forgot something. We, in the very first weeks of the pandemic, we collaborated with Map Action. I forgot, sorry about this, but Map Action provided us with a nice visualization dashboard in the very first, especially in the very first week of the pandemic, in displaying the government measures around the world. It's still online, now it's full of measures around, but we are restructuring it as well. Thank you very much for your attention. Look forward for the questions after.
Thank you very much, Claudia. And now, just to introduce Eva Constantaras, our second speaker is my colleague from Internews, Eva Constantaras. Eva is Internews data journalism advisor, and a pandemic health journalism mentor. Her grounding in the data journalism practice comes from having been a Google Excellence scholar. So she's got very strong academic credentials there. And she has devised data journalism training programs globally for Internews and helps equip journalists with the necessary tools to navigate the data minefield and present it for their audiences to understand. And Claudia just presented a huge data set, which is in a beta phase, 2 data sets. Now Eva will explain how do you use these data sets in a practical manner as a journalist to present it in your stories so that your readers will be able to understand what you're talking about. So over to you, Eva. Thank you.
Hello, thank you very much for that introduction, Sunny, and thank you, Claudia, for presenting the data. It's actually very rare for data providers and journalists to play very nicely. I think it's one of the really great things to come out of the pandemic, that we all do see that we're working on common ground. And actually, that's kind of where I wanted to start. I wanted to explain how COVID-19 has kind of changed the media environment, and it's plunged journalists in the situation where they all of a sudden need to use data in order to meet citizens' information needs. And I think this context really helps us understand why data sets like this are so important for journalism media going forward. So what we see lately, and I think you see this in the news every day, probably it makes you very nervous, is that we see that media consumers right now are very overwhelmed. They're confused. We've seen the rise of populism. We've seen social media become sort of a playground for people to spread misinformation and disinformation. And citizens don't know how to get to the information that they actually need. And what we see is that citizens really are interested in better accountability reporting on exactly what their government is doing in response to COVID-19. They want to know whether what's happening to them is inevitable or not. So for the first time, they're turning to their trusted information sources to find this kind of quality information. But what we have is a skills gap. So journalists, they see this demand, but they're not familiar with research methods. They might not be comfortable with analyzing data, and they might just not be used to be doing accountability reporting in the first place. But for the first time, they see that this is the information that citizens are looking for right now. So there's a pressure that wasn't there before for journalists to meet this kind of information needs. So I think what ACAPS is doing is it's providing data in areas, and Claudia was correct, it's the secondary impacts data that's really of interest to journalists, and because it's really of interest to citizens. So the data that is being provided in these different categories, they actually hit on all of the topics that people really need credible information on. So what we're trying to work with journalists to do is to meet this skills gap through this very simple process. So what question do you want to ask of the data? Run the data analysis and tell a very simple story with that data. So this process basically applies to any journalist doing data reporting. So what I have up here is one of the first stories that broke in the US showing the coronavirus impact on Black communities. And this was a very sort of simple correlational study looking at concentration of ethnicity and coronavirus fatalities by neighborhood. Most countries do not have data at this granular level that you would actually be able to identify what neighborhoods people are dying in and what those people have in common. 90% of countries will not be able to do this story. So what are journalists supposed to do who want to show that inequality is being aggravated by coronavirus. So it's basically following the exact same process. So what I'm going to show is I basically, because this data set is so new, I wasn't able to find many stories that actually have used the data, but I found a lot of stories that would have been much better had they used this data. So I just want to show you, again, what's the process that you get from question to data to story. So one question to start with is that I see among all of my trainees is, what is happening to families that are dependent on remittances? For example, this is a story that is basically told in this way to look to see is the rich-poor gap being increased because all of a sudden everybody who is working abroad and sending money abroad to keep families from falling into poverty, all of that work was frozen, right? It is extremely difficult to quantify that. How are you supposed to know how many workers stopped sending money back and how much money have they stopped sending back? So that is a data set that is captured in the ACAPS data. And what the difference is journalists will tell this story with or without the data. They're going to tell a story about how coronavirus is impacting remittances without having any data. They're going to quote someone saying, yes, we certainly do believe it's a problem, but they're not going to actually be able to say we expect 20% of families to fall into poverty because we see that the numbers of people sending back remittances has gone down, right? Another example that we see being covered all around the world is what children are missing out on education, right? We've seen projections that the education gap is going to be huge and it's going to take decades to recover, right? So one of the ACAPS data sets is about the number of primary and secondary students affected by disruptions to the education facilities. There's also data on the number of students in schools. So what does that lead to? This leads to stories like this. So it leads to stories that let us see who is being pushed out of school because of COVID-19. Is it girls? Is it poor children? Is it ethnic minorities? And again, what this lets journalists do is it lets them actually root their findings in concrete data. It lets them actually quantify the socioeconomic problem that they see coming to light. I think one of the trickiest things, the most difficult topics for journalists to cover is the economic impact. Journalists do not have the economic knowledge to tell impactful economic stories. So what they end up doing is telling a lot of really superficial economic stories, right? Most journalists don't have the confidence to actually figure out whether the government's bailout programs are effective. How is this affecting poverty rates? Is this economic crisis being managed well for certain demographics, but certain demographics not? Unfortunately, what I see so far is this is a story out of Data Fight in Nigeria. What I see is most journalists are shying away from any kind of criticism of the government. So this one is looking basically about how Nigeria, instead of providing economic relief for poor people, is just servicing its debt. Like donors or lenders are basically demanding that they continue paying down their debt, so they're choosing to do that instead of helping citizens. I think the ACAPS data is really important on this topic because it lets them do comparisons across countries. So instead of just reporting the inflation rate in Nigeria and the poverty rate in Nigeria, they can do a regional comparison to show that, yes, my country is actually doing a worse job of controlling inflation rates or of holding down poverty rates because I have data, comparable data across countries. And with the level of economic reporting that's going on, having that data allows journalists to criticize the government in their reporting in a way that they wouldn't be comfortable without data that's comparable across countries. So I think we're going to see better and better economic reporting as journalists gain the confidence to use that data to compare what's happening in their country compared to how it's being handled in other places. I think this is one of the most vital ones because it's one of the most urgent ones. What is food insecurity look like in my country? I think this data set is probably the most up to date because the data collectors are used to responding to emergencies. So for most sectors, COVID-19 has broken all the rules of data collection, right? Like it's made them go on an accelerated cycle that they're not used to. But with food insecurity data, they're used to responding to crises. So this is an area where ACAPS is providing very up-to-date, very current data about changing patterns of food insecurity and can actually assess governments' responses to addressing food insecurity and providing emergency food aid. So Rappler in the Philippines has done a very good job of humanizing this issue. So they're not just reporting dry statistics on food insecurity. They're actually doing deep dives and profiles on what food insecurity has really looked like within the country and what services are failing. So with schools being closed, what is the country's food distribution system for school-aged children? Basically, it's failed, right? So they can start with that really interesting food indicator about food insecurity. They can show how food insecurity has grown in the Philippines, and then they can take a deep dive into what system fails are contributing to this problem, right? And what do solutions possibly look like? This might be a story that they wouldn't be comfortable doing without that data. It's a very difficult time in the Philippines to criticize the government. It's a very difficult time to say that their food distribution programs are failing. For them to be able to point to an international data set and say, look, the foundation of our report is from an external international data source that has counted the rise of food insecurity in the region. It makes it much more difficult for the government to criticize their reporting. I think one of the obvious ones in this, I think we see more stories of this, is the health system failure story. We can see really, really far-reaching impacts of short-term failures in the health system. And it's important for journalists to be able to sound the alarm on these issues using data before the problem gets any worse. So things like access to immunization, so not just the obvious stories that are being covered about, access to oxygen and ventilators. All of these countries' health problems did not disappear because of COVID-19. So as journalists are, they're sort of getting over the daily reporting of COVID-19 infection rates and are starting to look at, okay, how is this impacting health in my country? And one of the best stories I saw on this topic was by The Nation in Kenya. And this story looks at all of the ways that health gains are being undone now because of COVID-19. So not just immunization, but also the distribution of HIV medicine, nutrition programs, regular testing of children, all the resources that have been diverted from basic health care, all of the cancer treatment that has been suspended. So they did a very good job of actually looking at all of these health indicators based on things like ACAPS, so very general health indicators, and then they put together a picture of sort of a system-wide health failure and what it's actually going to look like for Kenya in the long term to recover its basic health services, even just to get to where they were before the pandemic started. Another one, I think some of the most popular stories in the US around data was actually looking at which workers are most impacted by the lockdown. So who are our victims? Who are our economic victims? One of the way ACAPS is trying to measure this is what I like is they're looking at both the formal and the informal sector. So what is the employment numbers and what are the livelihoods, both in the formal and informal sector? And again, that is a fantastic starting point for journalists to report on what do the employment patterns look like, and then dig deep into who are the people represented in these big numbers. So this story out of India, I think they knew that this was going to be an issue. They looked at the general unemployment numbers in India. They looked at regional patterns, and then they did a deep dive into how women farmers specifically are being affected. So again, looking at how gender is compounding this issue of employment and gender equality in the workplace, and how far this is setting back women who are working in one of the most unstable sectors, which is agriculture. So again, that they can take that general data and then find local data collection projects that allow them to explain the context, explore what the causes of some of these issues are, and what support government should be providing, what government programs should look like to make sure that these problems don't get worse. I think another thing, obviously, because of the U.S. situation, a lot of people are quite interested in how voting is going to be impacted by the pandemic. I think 9 or 10 countries have already held elections during the pandemic with very different results, and I think it's really important for journalists to be able to look at what has happened in these 9 or 10 countries in terms of how voter turnout was impacted by the pandemic, and what are the success stories and failures in getting people safely to the polls. So if you're covering an upcoming election, it's really important to be able to do comparative analysis, looking at what voter turnout has looked like in other places. Again, in Sri Lanka, this is ground truth, looked at this from several different angles. It looked at the public health and safety impact using data, and it was asking, it looked at the violation. Chris Habib, you are not muted.
Can you mute yourself, please?
Oh, it got quieter. Okay, and then I think one of the final things, and I think this is, for me, one of the most important issues is human rights. And I think it's really important that ACAPS is trying to quantify human rights violations, which is quite challenging.
Chris, can you mute yourself, please?
I think he's probably got his headphones out.
Sorry. This is Chris. I think it's Cleo because I shared the link with him. Cleo, can you please mute your mic? I'm sorry. He must have joined using the same alias as my name. I'm sorry, guys.
Thank you, Chris.
Okay, yeah. So looking at an invisible population. So prisoners are actually one of the most difficult populations to gather data about and do data-driven reporting on. Because data access is so difficult. We've seen that COVID-19 is, prisons are a hot spot for COVID-19. What we saw in Mexico, Animal Politico was reporting that the government was threatening to throw people in prison, especially migrants, to throw them in prison if they're not following COVID-19 regulations. So I think it's important for media outlets to be able to see what we're expecting to see is fewer people to be incarcerated, because in theory, people should be released to protect them from COVID-19. But what actually we see in some countries is the opposite. The prison populations are either not going down or they're going up as they arrest people for lockdown violations. And that's a really good sign of government overreach and authoritarian creep under the cover of COVID-19. So again, using data on the prison population is a much safer way for journalists to criticize their government and their response to COVID-19 and their crackdown on basic freedoms, using data and using comparative data across countries. So One thing I just wanted to touch on at the end is this is a very strange time for data journalists to be reporting because the normal rules of data reporting don't apply. For the first time, we need data. We need data right now, right? Usually we explain things like regression to the mean, and it's fine if your data is old because extreme values eventually normalize. That's no longer the case, right? So for data journalists, everything has been upended by COVID-19 because the data is just all over the place. And we're seeing journalists respond in really creative ways to draw attention to whatever data they can find, to draw attention to inequality, to bring attention to issues that were a problem before COVID-19, and this is their big excuse. This is their reason to talk about them. So I think it's really important that journalists right now are realizing that they do need to tell stories that count. They do need to tell stories about these gaps in inequality, and ACAPS is providing one of the few data sources that they can go to that's reliable data coming out and closer to real time. If you're working, if you're a journalist or you're working with journalists on reporting on COVID-19 or other data stories, the resource site we have set up is at datajournalism.internews.org. We have training resources available there and ways to think through projects and approaches to teaching data journalism and sample stories that have come out both about COVID-19 and about other stories in these sectors that were published before the public health crisis. So I'm going to end there. I hope that provided sort of a brief overview of the potential use of these data sets in many different countries in many different contexts. And I'm excited to see the database grow and journalists begin to use this really valuable data.
Thank you so much, Eva. Just something for Claudia. Claudia, can you explain your analytical framework, which you have developed from your data sets, because it's both it's mixed methods. It has a qualitative explanation together with the quantitative side of it.
Well, the concept of analytical framework, we actually, in ACAPS, we use analysis framework for pretty much every product we have. And I mean, the specific one, let's not talk about the government measures one. Let's talk about the secondary impacts. Basically, what we do is we try to identify like spheres of a phenomenon that can actually try to measure impact or try to, let's say, a framework will help you to have a lens on the reality and will, in principle, facilitate whatever you are going to try to analyze, because it helps you putting reality into little boxes, and then you can have a look at these boxes in a way that you can play with numbers, you can play with information. In this case, and for the secondary impacts, the thing that we saw is like we have indicators and numbers concerning, let's say, usual indicators such as, I don't know, poverty rates, inflation, as you mentioned in your nice presentation, Eva, and but then you will have a bunch of others qualitative information that you find around by reading stuff. So at ACAPS, usually we try to put together one side of things and the qualitative side of things. How? Numbers per se, they don't explain much. Numbers, they need to be comparable. Numbers, they need to be developed in a way which makes sense and so on. But numbers try to describe something, but then for whatever it's an explanation of why something is happening or where this phenomenon is going to go, you will need qualitative information. So in this data set, the secondary impacts, we try to capture both sides of things to be able to enable ourselves in the future and other users nowadays, like Eva is doing, to try to tell stories based somehow on numbers, but then enriched by other information and hopefully can lead your analysis somewhere that is meaningful and right. I hope this answered your question.
Thank you, Claudia. Just to jumpstart the Q&A, if you have questions, don't be shy. You can put them in the chat. I have a question for both Claudia and Eva. One thing that we journalists grapple with, and especially in the instance of reporting on the second wave, and in Hong Kong, I see stories in the South China Morning Post referring to COVID now as the fourth phase in Hong Kong. How do we go about in ascertaining excess deaths? Comparing it over a period of time, and there are excess deaths, but the health authorities are not attributing it to COVID, but the deaths are there. How can we as journalists make assumptions that, hey, there's something happening? Are we going into the second wave or the third wave or the fourth wave? Yeah. So both to Claudia and Eva.
I mean, I could say it'd be really nice to have that in ACAPS data. Yeah, because it's always counted different, right? So every country's, mortality statistics are calculated in different ways. There's been efforts to standardize them, but they're calculated in different ways, and they come out under different cycles of publication. So some publish weekly mortality statistics, some publish them yearly, some publish them, disaggregated by geography. Causes of death are, categorized in different ways. It's actually one of the messiest, most difficult data sets to deal with. So like the easy answer is just to say, you compare the average deaths from this time this year to the average, for the last 5 years, and you get a number. But again, it depends quite a lot on different factors and what the government may or may not be doing to control the narrative and changing the way it gathers and reports that data. So I think it's probably I imagine for ACAPS, it's one of the most difficult areas to standardize and to make comparable across countries, just because everybody's collecting it and reporting it in a different way.
I pretty much agree with you. Well, definitely, yeah, taking averages of this period against the 5 past years, it's a way you can look at things. You can definitely probably say that something happened, and probably due to COVID-19, you cannot be certain. But as you mentioned, Eva, I mean, so you can do this for some countries, but for some other countries, you will never be able to do this from now and in 10 years, maybe. I think about the way of reporting in many countries where I had the chance to work in, and sometimes you have data of 10 years ago, like official data from the statistical office somewhere. It's 10 years old. So we can say, I mean, probably in Europe, you can say somehow that there is an excess death rates that probably is COVID-19, probably, because this year was big. Then, of course, my suggestion is you can make assumptions. You're always free to make assumptions, but be transparent, whatever you say. So also say that your assumptions might be wrong.
Thank you very much, Claudia and Eva. I mean, speaking from experience with regard to 2 countries that we're working on and have worked on. In Indonesia, there's a lag there's a lag in reporting actually, and journalists have been getting anecdotal evidence of the increase in death rates by speaking to grave diggers in, for that matter, in Jakarta, because in Jakarta, when you dig a new grave, you have to register it with the parks authority. And also in Afghanistan, where data reporting is just, there's a serious lag of reporting over there with regard to COVID. And journalists too have been speaking to grave diggers, and they've been doing stories based on their interviews with grave diggers, saying that they've been exceptionally busy through the week or through the month, and with the number of cases coming in, with the number of corpses coming in and graves being dug. We also have a problem in Turkmenistan. The government denies that there are COVID-19 cases over there, but journalists have spoken to grave diggers again, and grave diggers are saying, like, look, we've been like pretty busy. It's overwhelming. So my question to both of you is, how, if journalists are reporting the anecdotal death rates, speaking to grave diggers and getting just anecdotal evidence, how valid it is in the circumstances that they are working in?
I mean, valid is it's a tricky term. I think one thing that when I've been teaching data journalism in a lot of countries where the journalists are not covering the top 3 causes of death in the country. COVID-19 is not anywhere close to the top 3 causes of death in the country, yet there's this little obsession about being able to count the COVID-19 deaths when I've asked them, have you looked up how many people have died from the top 3 causes of death in your country, whether it be malaria or, heart disease, whatever it is, malnutrition related diseases like diarrhea. So I think there is this sort of like obsession with chasing COVID-19 is the shiny new thing, when there's a lot of potential just to explain to citizens that the reason COVID-19 is such a big health threat is because the country's healthcare system is a failure. So look at what's the, doctor-patient ratio. What are the biggest, causes of disability in the country? There's a lot of really interesting data to be analyzed at a subnational and sub-demographic level to help people understand why COVID-19 is such a big threat, just because of how little the government has invested in taking care of the health of the population. So I would almost try to redirect them and use COVID-19 and the grave diggers as a hook for their story, because it's a nice, kind of morbid story, but like use that as a way to educate people about what the healthcare system in their country looks like and what it would take to make it more robust and resistant to whatever health threats really emerge.
Again, I pretty much agree with Eva, and it's a very good point. And that's, I have the analyst mind and you have the data journalist mind, and it's definitely true. No one is probably denying that there are more graves, but it's like the real question is why. It's not just COVID-19, but why people are dying more. Health system. So like a journal, probably ACAPS will not say this because we work in another way, but probably a data journalist can actually redirect and shape a little bit more the story focus on, okay, but the real problem here is COVID-19 is disrupting health system, and many of us will live in countries where health system money has been cut over the past years and so on.
My last question to Claudia. we're past the 10 months into the declaration of the pandemic. What's next for ACAPS? You've developed this to very interesting, extensive data set. One data set is still in the beta phase. So how are we going to take this form? What is ACAPS? What is ACAPS' next steps actually? Because the pandemic is, I think, will be around.
Yeah, for a bit.
Yeah.
So I guess well, ACAPS first of all, let's not forget it. ACAPS on the top of this, it's doing its own business all the time. So constantly monitoring also humanitarian crisis. So this will go on for sure. And as you mentioned, we are going to consolidate the secondary impact data set, hopefully soon when we have the first good amount of countries covered. And then probably when we consolidate the methodology and everything, maybe we will look at how we can use ourselves to do some further analysis with this data set. That's but the priority is still finishing these data sets, consolidating it, constantly ensuring quality, and then we might also be able ourselves to produce some analysis on it.
Thank you, Claudia. We've got one question that has just come in. This is addressed to Claudia. When ACAPS runs an online survey during the COVID-19 outbreak, obviously pandemic, how did you increase your survey response rates? For example, did you use a social media network to communicate about it? This is from Rehab. Thank you.
I'm not a survey person at ACAPS, so probably my answer will not be the best. But usually we have a pretty much strong comms department, and whatever we try to increase, especially if it's online coverage, it goes through social media. Well, it goes through communications policies, and they use social media, and they use also our mailing list contacts that we have. That's what we do. I'm not a comms person, unfortunately. Sorry if I'm not exhaustive with that.
Thank you so much, Claudia and Eva. And I know especially Eva has been in back-to-back trainings and also just fresh off the boat from a conference, from our Asia conference. And she's got training again tomorrow, I think. Yeah, so thank you so much. And thank you, Claudia and Eva. And this recording is available on our Facebook page. And we'll also be putting it in a couple of days on our new YouTube channel. So if you have missed it, if you wanna send the recordings to your colleagues or whatever, you can share our Facebook link here at Internews COVID-19. Thank you so much and stay safe. Thank you very much.
Thank you.
Thank you, Sunny.
Goodbye.